Tackling the opioid epidemic, the first major order of business for the state legislature. A bipartisan agreement, the unanimous passing of the Arizona Opioid Epidemic Act.
Many here today have been personally impacted.
Governor Ducey signed the bill Friday morning. Since June, at least 800 people have died from an opioid overdose. That's about 3 lives lost each day. Dr. Daniel Derksen oversees the Center for Rural Health at the University of Arizona, which just received a $2 million federal grant to reduce opioid deaths. We asked him how new legislation begins to address the crisis.
This is a public health approach to a very difficult issue. So you want to do some things on enforcement and make sure that the enforcement's there. You want to do some things on education to make sure individuals and their family members really understand what's available to them. This is something that is a nonpartisan issue. This is something that will take efforts on all fronts, and people have to really look at, here's the things within my sphere of control as a prescribing provider, as an individual, as a pharmacy, as a state agency. Here's the things we can help with, but we can't just do it in our own areas. We have to make sure that we're looking at the data, we're identifying places and areas where we need to make further interventions, because I don't think this will all be done in one fell swoop.
State lawmakers approved some steps in a special session this week. Among them, requiring prescribers to only give patients 5 days' worth of opioids if it's the patient's first prescription for the drug in an attempt to prevent addiction. Some exemptions include cancer patients or those recovering from traumatic injury.
It's a tricky balance to make sure that that you don't become so strict in these regulations that people don't get the treatment that they need. There's something like 88,000 licensed health providers in the state of Arizona that can prescribe these controlled substances, including opioids and benzodiazepines, things like Vicodin and Percocet, and then on the benzodiazepines, things like Valium. There's only about 150 individuals who are certified to be able to give medication-assisted treatment to help people addicted to opioids get off of them through drugs like Suboxone. So we need to strike a better balance of what's appropriate. There's been a real effort to involve the prescribing community.
Other measures, $10 million to help treat addiction for the uninsured or underinsured, and expanded access to naloxone, a drug that helps reverse the effects of an opioid overdose and can be life-saving.
So first responders are being trained, emergency medical services personnel, police, fire department personnel that may be the first individuals to arrive on the scene. But very often the very first responders are family members that may find their sibling or their spouse or a friend in an overdose situation. They know that they have a opioid use disorder, that they're addicted, and then suddenly they see an overdose in the house. Most of the overdoses occur in a personal residence in this state.
Since the governor declared an opioid emergency last June, Arizona's Department of Health Services tracked at least 5,200 suspected opioid overdoses, with more than 990 in Pima County and at least 3,100 in Maricopa County.
It would be easy to dismiss this and say, well, we should just incarcerate people who have addiction problems. And that's a very expensive way to approach it. What I'd compare it to is if there was 2 or 3 people dying a day, there's something like 100 to 270 overdoses per week in Arizona. If this were Ebola virus or people being exposed to that, you would get a whole different level of urgency. But the urgency should be just as high for this epidemic as it would be for an infectious disease. This isn't just affecting a certain segment of the population. This has penetrated our high schools, our grade schools, wherever you live in the state, whether it's rural or urban, Phoenix, Tucson. So we have to really take this to a whole different level if we're going to make an impact.